In this video, you'll see how to examine the arms and legs to assess the peripheral vascular system, including the arteries, veins, and lymph nodes. During the examination, you'll see normal findings. In daily practice, you may see clients with similar findings or with normal variations or abnormal findings. Before examining the peripheral vascular and lymphatic systems, consider their anatomy. Recall that the vascular system consists of vessels that transport fluid, such as blood or lymph. It consists of arteries, veins, and lymphatic vessels. Arteries carry oxygenated blood from the heart to all body tissues. Each heartbeat creates a pressure wave that makes the arteries expand and recoil throughout their length. However, this pressure wave, or pulse, can only be felt where the artery lies close to the skin and over a bone. In the arms, the pulse is palpable in the brachial artery, at the antecubital fossa, radial artery on the flexor aspect of the wrist, and ulnar artery. In the legs, the pulse can be felt in the femoral artery in the groin, popliteal artery behind the knee, dorsalis pedis artery on the foot, and posterior tibial artery behind the medial malleolus. Veins drain the deoxygenated blood from the tissues and return it to the heart. The arms have two types of veins. The superficial veins lie in subcutaneous tissue and transport most of the venous return. The deep veins are wider in diameter and have thinner, more elastic walls than their companion arteries. The legs have three types of veins. Deep leg veins, such as the femoral and popliteal veins, conduct most of the venous return and have the same names as the arteries they accompany. Superficial leg veins include the great saphenous vein, which runs from the foot to the groin on the inside of the leg, and the small saphenous vein, which runs from the foot to the knee on the outside. Perforators are veins that join the great saphenous vein with the deep veins on the medial side of the calf. The lymphatic system is a separate vessel system that returns excess fluid from the tissue spaces to the bloodstream. Along these vessels lie lymph nodes, which are small, round, or oval clumps of lymphatic tissue that form a major part of the immune system. In the antecubital fossa, the epitrochlear nodes drain the hand and lower arm. In the groin, the inguinal nodes drain most of the legs, external genitalia, and anterior abdominal wall. The horizontal group lies just below the inguinal ligament. The vertical group extends down the thigh.
Before we begin, I'd like to ask...
To obtain data that will round out your examination, focus the health history on concerns related to the peripheral vascular and lymphatic systems. For example, ask about symptoms such as leg pain or cramps, skin changes on the arms or legs, leg swelling, and lymph node enlargement. Also, find out if the client takes any medications that could affect the peripheral vascular system, such as oral contraceptives or antihypertensives. For most clients, you won't need equipment to do this examination. But if your client has abnormal findings, you may need a tape measure, tourniquet, blood pressure cuff and stethoscope, and Doppler ultrasonic stethoscope.
I'd like to examine your hands and arms.
Because you would have checked the client's blood pressure earlier, start by examining his arms, beginning with his hands. Note the color of the skin and nail beds, as well as the skin's temperature, texture, and turgor. Check for any edema or lesions. The arm should be the same size, with no scars or other lesions. Also view the fingers from the side to detect clubbing. Normally, the nail bed is at a 160-degree angle. Next, palpate both radial pulses, noting their rate and rhythm. Grade the pulse amplitude on a 4-point scale, in which 4+ is a bounding pulse, 3+ is increased, 2+ is normal, 1+ is weak, and 0 is absent. Next, palpate the brachial pulses in the antecubital fossa, just medial to the biceps tendon. Their amplitude should be equal bilaterally. Then palpate the epitrochlear node by supporting the client's arm, reaching your other hand under his elbow, and feeling in the groove between the biceps and triceps muscles above the medial epicondyle. Normally, the epitrochlear node is not palpable. Repeat the procedure on the other arm.
I'd like to check
Finally,
the
perform the
hands
Allen
palmed
test
up.
to assess radial and ulnar artery patency. With the client's palms up, compress both radial arteries with your thumbs and ask him to open and close his fists a few times. This should make his hands look pale. Then keep the arteries compressed as he opens his hands and look at his palms. They should turn pink promptly. Now repeat the Allen test while compressing the ulnar arteries.
I'm going to examine both of your legs.
To examine the client's legs, have him lie down. Drape him so that his genitalia are covered but his legs are exposed. Then inspect both legs, noting skin color, size changes, including swelling or atrophy, hair distribution, venous pattern, and any skin lesions or ulcers. The leg color should match the rest of the body, and the legs should be symmetrical, should be evenly covered with hair, and should have a flat, barely visible venous pattern with no lesions. Diabetes mellitus is common among Native American, Black, and Hispanic people. In these clients, be especially alert for leg vessel changes caused by diabetes, such as coolness, pallor, diminished pulses, thin, shiny skin, and foot ulcers.
Bend your legs.
If the lower legs look asymmetrical, measure the calf circumference with a tape measure at the widest point in exactly the same place on each leg. The measurements should be the same. Next, use the backs of your hands to palpate the skin temperature, comparing symmetrical spots. The skin should feel warm and equal bilaterally. Now test for any tenderness by flexing the client's knee and gently pressing the calf muscle against the tibia. This maneuver should cause no pain or tenderness. Then, palpate the horizontal and vertical groups of inguinal lymph nodes. If palpable, the nodes should be smaller than 1 centimeter, movable, and non-tender. Next, palpate the peripheral arterial pulses, starting with the femoral pulse. With your fingers just below the inguinal ligament, halfway between the pubis and anterior superior iliac spine, press firmly and then release slowly.
Bend your knee
If
out
the
to
femoral
side.
pulse is difficult to find, such as in an obese client, ask him to bend his knee to the side in a frog-like position.
Lift your
Then
knee.
assess the popliteal pulse. With the client's leg relaxed and slightly flexed, anchor your thumbs on his knee and curl your fingers around behind it. move your fingers forward to press the artery against the bone. Usually, the pulse is just lateral to the medial tendon. If you have difficulty finding the popliteal pulse, turn the client over, lift his lower leg, and rest it against your shoulder or arm. Then press deeply into the popliteal fossa with both thumbs. For the posterior tibial pulse, curve your fingers around the medial malleolus and press gently. You should feel the pulse in the groove between the malleolus and Achilles tendon. If not, dorsiflex the foot to make the pulse more accessible. For the dorsalis pedis pulse, lightly palpate just lateral to the extensor tendon of the big toe. Remember to palpate the posterior tibial and dorsalis pedis pulses on the opposite foot. In a person over 45, these pulses may be harder to find. If this occurs, continue your search using the Doppler ultrasonic stethoscope. In an older client, you may see trophic changes, such as thin, shiny skin, thick ridged nails, and loss of hair on the lower legs. They are usually associated with arterial insufficiency, but also can result from normal aging. All pulses should feel regular, 2+ in amplitude, and symmetrical bilaterally. Next, check for pretibial edema. Firmly depress the skin over the tibia for 5 seconds and then release it. Do the same thing over the medial malleolus. Normally, your finger should leave no indentations or pits. In a pregnant woman, you may see diffuse bilateral pitting edema, especially at the end of the day and in the 3rd trimester. You may also see varicose veins.
I'd like you to stand up and turn around.
Next, have the client stand so that you can assess his leg veins. They should not be visible, dilated, or tortuous. Use additional techniques if you suspect vascular problems in the legs. For example, if the client has varicose veins, use the Trendelenburg test to assess valve competence. To do this, elevate the affected leg 90 degrees until the veins empty. Then place a tourniquet high on the thigh. Help the client stand up and watch for venous filling. The saphenous veins should fill slowly from below in about 30 seconds. Then take off the tourniquet and observe the varicose veins for sudden filling from above. This should not occur.
Lie down on the table.
If you suspect an arterial deficit, check for postural color changes. With the client supine, raise his legs about 30 centimeters off the table and have him wave his feet to drain the venous blood. After 30 to 60 seconds, inspect the feet. In a light-skinned client, they may look a little pale, but should still be pink. In a dark-skinned person, color changes may be difficult to see. However, extreme color changes should be visible on the soles. Now have the client sit up and dangle his legs over the side of the table. Compare the color of both feet and note the time it takes for color to return to them, usually 10 seconds or less. Also note the time it takes for the superficial veins in the feet to fill, usually about 15 seconds. You should see no rubor or dusky redness. If the pulses are weak in the legs, use a Doppler ultrasonic stethoscope to magnify them. After putting coupling gel on the handheld transducer, place it over a pulse site, swiveled at a 45-degree angle. You should hear a pulsatile whooshing sound. Finally, determine the ankle arm index, or AAI. Using a blood pressure cuff above the ankle, Determine the systolic pressure of the posterior tibial or dorsalis pedis artery. Then take the systolic pressure of the brachial artery in both arms and use the higher number. To get the ankle-arm index, divide the ankle systolic pressure by the arm systolic pressure. The result should fall between 1 and 1.2. An ankle-arm index of 0.9 or less indicates peripheral vascular disease. Once you're done examining the peripheral vascular and lymphatic systems, take the time to discuss your findings with the client and answer his questions. Also, teach him how to maintain his health and provide related self-care.